This animation is based on a true story. Once upon a time, there was a young couple who were deeply in love. After being together with just the two of them, they wanted their love to grow, and so their story began. Almost 9 months later, after a normal pregnancy, the couple became parents to a beautiful girl. The baby was born premature and had a sensitive and scaly red skin called neonatal erythroderma. She was born in a small regional hospital where the doctor told the parents that she had a skin condition and had to stay a little longer for further research. Due to the holidays, the dermatologist of the hospital wasn't available, so it took a whole week before they did a skin biopsy and gave the baby girl a feeding tube. A few days later, the parents were finally able to take their newborn home. Unfortunately, this appeared to be the start of a period of frequently visiting the hospital. The baby's temperature was low and they were not able to get it under control. And the parents were sent to different doctors, but no one was able to answer their questions. It seemed like nobody really knew what was going on. It was a very uncertain and stressful time. A couple of weeks later, they insisted their baby had to be seen at an academic hospital. Once there, the doctors gave advice, and the parents felt like they were taken seriously in their feelings of anxiety and worries for the first time since the birth of their daughter. But after staying home for a few days, the baby's temperature went up too high, and they rushed to the regional hospital. And again, the doctors told the parents not to worry. 1 week later, the baby laid suddenly very sick in her crib. It was life-threatening. She was transferred to an intensive care unit, and antibiotics were started immediately. The medicine didn't work, and the situation got more worse in a short amount of time. Sadly, the baby was just 2 months old when she passed away. After an autopsy, the baby was diagnosed with a severe immune deficiency. Every person in this story has experienced the impact of desperation. This should never happen again. That is why an international protocol has been developed to diagnose neonates born with a red skin, with or without scaling.
My name is Edwin Caretakers. I'm a dermatologist from Harderwijk Hospital in the Netherlands, and I'm a PhD student from the Erasmus Medical Center.
I'm Suzanne Pasmans. I'm a professor in pediatric dermatology at Sophia's Children's Hospital in the Erasmus Medical Center.
But the first experience of seeing a red baby was very difficult, and I assume that it's difficult for a lot of clinicians. Because you don't recognize it, you don't know how to handle it. It was confronting, and because of the baby deceased a few weeks later, it was very. I felt very pity. It felt very also maybe a little shamed. Could I do it differently? And it took a lot of my mind those days. Yeah.
There was a child that looked as a very healthy neonate. The only thing that was remarkable was that the child had a red skin, and unfortunately the child died a few weeks later, and it occurred to be an immune deficiency that caused that she died. And that a challenging period started because we thought that might never happen again, and Edwin Caretakers developed a protocol for that, and we called that the neonatal erythroderma protocol. The result is that during the last 8 years, as far as we know, no child born with neonatal erythroderma has died.
Tried to prevent this same situation. And that's why I went into the research area of neonatal erythroderma. Well, the research is especially focused on getting the diagnosis right. And the importance is that there are a lot of diagnoses possible from a quite benign course to a very severe course, to a fatal course. So there are a lot of possibilities. Yeah, that's how do we prevent the same situation was quite difficult that time. There is no systematic protocol guidelines. So we tried to develop one together with specialists from out of Europe, the European Reference Network of Skin.
And we are happy to work together with other professionals who are really specialized in neonatal erythroderma, always look together for solutions. So I think the multidisciplinary approach is very important in these children. I think we also help indirectly with that approach the parents.
My name is Urban Rice. I'm neonatologist here at the Erasmus MC Sophia Children's Hospital, head of the department neonatology and also professor of neonatology. Yeah, neonatologist specialist taking care of neonates, so infants who are born term or preterm and are critically ill or ill in the first 28 days of life. The skin is not fully developed in those patients, and from a neonatal point of view it's very important, and the skin is a very large organ. It's perhaps the largest organ we have, you know this much better than me. And I think it's really important to have the water balance under control, the electrolytes under control. So it's a very complex system which you have to have in balance.
My name is Saskia van Baarle. I live together with my husband Bob and my family, 2 daughters. Olivia, she's 9 years old. And Filina, she's 3 years old. We live in Breda, and Olivia is affected with Netherton syndrome.
Well, the first week that Olivia was born was quite intense for us. So she had a scaly red skin, and the doctors were quite shocked. So were we. So we decided to have her in the neonatal intensive care for the first week. Is this something that is treated within a couple of days and then it's over, or is it a genetic disease? And so we had tons of questions that couldn't be answered because the doctors didn't know what Olivia was affected with.
And then, so she was in NICU in the incubator for 2 to 3 days, and then we moved to the normal ward.
NICU ward, yeah.
Yeah.
You know, the incubator gives us the opportunity to play with the humidity. The skin is also important for barrier, for bacterial barrier. Of course, outside the incubator you have also other circumstances like the temperature, the room temperature, the humidity in the room. It's very important for such an individual case with erythroderma that you can manage in a personalized way, and this is only possible with an incubator.
The first step is important, is just taking the history and the physical examination by not only dermatologists but also by the neonatologist, for example. And second is that you have to focus on physical appearances, not only the redness but also are there physical clues that can lead you to a specific diagnosis. So the history and physical examination is part of step 1. Yeah, physical clues can be for example blisters, as we all recognize, hair deformities, collodion membrane, so the very thick skin with fissures that are important elements. Yeah, there are a lot of them. Investigations you can do. Look at a basic lab, so the blood investigation. Mostly those are focused on complications like dehydration and infections. Secondly, you can do histology, so taking skin biopsy, genetic analysis, or related to the hair loss and hair deformities, you can have a trichoscopy, so you look at the hair under a microscope. Yeah, well, if you don't find a diagnosis, it's very important to have some clues and some advice from other specialists, other healthcare specialists like a pediatric immunologist or a pediatrician on metabolic diseases, and look for other clues. The clinical geneticist is very important when you ask me. I think the genetic investigation is, well, I think one of the most important things. So if you have a standard lab investigation, please start with genetic investigations.
To find out what kind of the genetic disease Olivia had, we decided already in a very early stage of her life to travel to the Netherlands, see a number of specialized doctors. The hospital that was specialized in rare and genetic skin diseases. They said, let us do the investigation.
And they said, okay, we will start genetic testing, but it will take a while. We have a list of like 10 diseases that are likely, and we are going to test from the most common one to the most rare ones. So it took eventually 1.5 years until we really found out that Olivia had Nether syndrome.
Well, of course, the question is, how long does it take to get a diagnosis? Specialized centers, I think you can manage a diagnosis, genetic diagnosis in this case, I think in a few weeks, maybe 2 to 4 weeks. There is of course a standard common treatment for neonatal erythroderma, irrespective of a diagnosis, that you keep on continuing until you find the definitive diagnosis.
The most important thing is that the child stays healthy and that we take care of the child at that moment. And also take care of the parents, because the parents feel very uncertain, because they don't know whether the child will have a benign or a more severe course.
I remember asking the doctors we were seeing for Olivia, there is not much attention for parents. What does it do to you? What kind of what to expect in the future? What to do with your worries?
Taking care of the parents and the whole process is very, very important from the beginning in a multidisciplinary way. As I mentioned, confronted for the first time. There are many questions. What does this mean for the future? What does it mean for now? Is my child surviving? Etc., etc. How can I manage it? How can I do skin-to-skin contact with someone who has skin lesion? But not only in the neonatal period. I think it's also very important to have a structured follow-up program. And this all together might help to improve the outcome and also to develop perhaps in the future new innovative therapeutic strategies.
I remember that the first time we went to Erasmus, that was a really specialized skin disease center, and when we were seeing Professor Pasmans together with Olivia, and we heard about this Huidhuis and that there is an association for ichthyosis scaling skin disease like Nether syndrome, that we really had the feeling we were in good hands.
They try something to improve, because even a small improvement in her skin means that she looks much better, but also feels much better, less itchy.
The well-being.
So even small improvements are meaning a lot.
Yeah, I think it's important for these children and the parents to go to an expert center who really knows what neonatal erythroderma is, how to approach it, how to diagnose it, and to treat these children.
Yeah, you can continuously read all the papers and read all the websites. To be honest, I don't think that it will help you a lot, because it will generate a lot of worries about the future. But you really have to live day by day, apply the cream, and stay close together. I think that is the best advice and the most simple advice that we could have had.
Well, on experience, how did it go since? Well, surprisingly, no one died. I heard. So the protocol, as we developed years ago, and we updated it recently, of course, that no one died. So the protocol, well, apparently it works. It works good. Well, the collaborators are a lot of people. We published the protocol, which was published together with a lot of people from the European reference network SKIN. Those are a lot of specialists across Europe, and we developed the protocol, and it is published in the Journal of European Academy of Dermatology and Venereology.
Go to the European Reference Network. There you see what neonatal ureteroderma is, how the advice approaches for professionals but also for patients, for parents in this case. Look for the expert centers on the sites of the European Reference Network, and there in every country there are also national expert centers. You can find them also there, and approach those centers for help and ask your dermatologist or pediatrician that's taking care of your neonate to contact the expert center about how to approach this child, and maybe to transfer the child to the expert center.